Hey guys, I am checking in at around the 5 week mark. It's been just a little over 5 weeks since my surgery on my patellar tendon. So I want to check in, kind of let you know what's been happening. So I go back to my surgeon next week for the 6 week post-op appointment. So I'm looking forward to that. I'm hoping that she tells me that I can ditch the brace within a couple days of that. So that's the hope. Now, I have been walking around my place a little bit without the brace, taking a lot of caution and careful steps. It is pretty easy to get around without the brace. I do definitely favor my strong leg, and I can definitely feel some weakness in the knee still. So I'm just being very careful, just a couple steps here and there. Anytime I leave the house, I have it on. I have gone back to work, and I can bend the leg a little bit while sitting in the chair. I don't know what my degree of flexion is exactly. I would say it's probably a little around 90 degrees or so, maybe a little bit better than that, but I can tell you that my leg strength has gone way up. So I have been going to PT. I finally met with a therapist that I really like, and his doctor actually, and I'm really happy that I'm finally working with someone that I feel like understands the places that I want to get to. So I think that's an important point. Like, if you go to like a physical therapy center that you work with like a few different therapists or whatever, find the one that you really like and that you can work well with, and also ask to be challenged. You'll know the difference between pain, which is not good, and soreness, which is okay, and you'll know the difference between pain and tightness. I think at least the people that I've heard from and worked with and whatnot, they've said the difference between stopping, okay, I've had enough, is pain. So if it's pain, you should stop. If it's soreness or a little bit of just weakness, you can keep pushing through. Let's see, what else? I am looking forward to continuing to get some strength back in my quads. I can tell you right now that I don't have control of my quads. Like, that's one thing that is still weird to me. Whenever I flex my quad, both sides like quiver a little bit, and that's something that I'm gonna have to keep working on and figure out a way to regain control of. So my therapist has given me some exercises that will strengthen the inside part of the quad really well, which I'll show you. I'll show that right after this. Basically, it's just like a leg raise, but flexing certain specific muscles to engage that part. It's really funny too. I was telling him, like the muscle in my leg, I feel like it's not really strong anymore. He's like, well, honestly, you don't have a muscle in your leg. So I was like, okay, damn, that's like pretty harsh, but that's the reality of it. And since I started trying to do some of the strengthening that he's recommended, my quad's starting to feel a little sore, which to me is a good sign. It means that it's being worked and it's growing. So that's exciting. I'm just gonna go over a couple of the exercises that I've been doing at home or even at work when I can sneak in the time. Other than that, I am gonna continue to push as hard as I can while staying in a safe spot with my leg. You don't want to overdo it. And I guess that's it. I will check back in after my 6 week appointment with my surgeon, and we'll just go from there. So I'll talk to you later.